Good morning, everyone. Welcome to the webinar, Introduction to Ohio's Warm Transfer Project, What You Need to Know and How to Get Involved. With me is Michael Bizzelli, Associate Director for Problem Gambling Network of Ohio, and I am Derek Longmire, the Executive Director of Problem Gambling Network of Ohio. A little bit about Problem Gambling Network of Ohio, or PGNO. We are a statewide 501c3 organization, and we are the state affiliate to the National Council on Problem Gambling. 35 states have affiliate chapters, and Ohio is one of those states, and PGNO serves that role. We are a membership-based organization, and membership benefits include connectivity, networking, getting a sense of what's happening in the state and nationally, as well as an opportunity to help support a statewide organization. Members' dues help support our advocacy and lobbying efforts that go on at the State House and nationally, and we rely on those dollars because we cannot use any state or federal grant funds to help support that. Our mission at PGNO is building a network of support for those impacted by gambling through collaboration, education, and research. We do that in a variety of ways in those who we serve. So we, a couple of years ago, thought of who do we serve in Ohio, and came up with some different answers. One answer was communities, another said individuals and families, and then we have the workforce. So after some deep thought, we really landed on we serve all three in different capacities. So we serve communities through promoting the gambling service resources that are available throughout the state, including the Before You Bet campaign, as well as Change the Game Ohio and the Ohio Problem Gambling Helpline. With those individuals and families, we provide those quality assurance calls to that helpline to ensure that anyone who calls the helpline will receive standard levels of care through any time of day, no matter who you are and no matter who answers that helpline call. And then through the workforce, with workforce development through a variety of ways, with training, through webinars, through our annual conference, and the in-person trainings that we offer. PGNO's approach is one that's neutral. We're neither for or against gambling. Our role is to really advocate for consumer protections related to any legalized gambling expansion. Big focus now would be related to sports betting, internet sports, as well as kind of that new strange emergence of esports. And we also really embrace that disease perspective that disordered gambling is a disease such as alcohol use disorder or diabetes. So it should be handled and addressed in a similar way, understanding that it is a disease and with that respectful nature, and really working to have the person impacted by the disease be helped in as many ways as possible. And thinking about gambling services, we know that there's limited public health attention on gambling compared to other health issues throughout the state and nation. And it's really our focus to make sure that gambling isn't one of those afterthoughts, but is something that is front of mind as we talk about public health problems that we see. We also know that there's high-risk behaviors with gambling that are also correlated with other high-risk behaviors such as alcohol use or substance use and mental health issues. So gambling doesn't happen all by itself in a silo. It really is involved with other things as well. So it really needs to be addressed in a holistic and collaborative way. And then last bit is stigma. So often I hear in talking with community members is that, well, if somebody has a problem, they should just quit. Not understanding the disease component to disordered gambling or all the other things that factor into gambling that would encourage someone to continue to play even though they're experiencing problems. So working on that stigma reduction as well. Ohio Problem Gambling Helpline, Mike's going to talk a little bit about through that data and give a sense of where we are in the state with that helpline.
Thank you, Derek. We thought before we would go into the Warm Transfer Project, which is essentially a project with the Ohio Problem Gambling Helpline, we wanted to give a brief background and show a little data on the call line And the Ohio Problem Gambling Helpline has been run through the United Way of Greater Cleveland 211 for a number of years. And they've been a great partner who are really able to show us a lot of data. They're able to map out the state or county as to where calls are coming in, so we can look at high call volume. That way we can target certain population areas when it comes to things like trainings, or where we need to be focusing more outreach, where people seem to be dealing with more issues because of those calls coming in from those areas. So they're really able to give us a lot of data and a lot of really pinpoint data. When it comes to overall numbers, there's over 5,000 calls annually to the Problem Gambling Helpline. Approximately 50 to 100 callers per month ask for gambling treatment services, and approximately 60 callers per month call for Gamblers Anonymous meetings and locations. The next slide will show us broken down into counties. So these are the 12 counties that received the most calls in fiscal year 19. So you can see Cuyahoga County having about double the next, which is Franklin. And Cuyahoga being Cleveland, Franklin County is where Columbus is. Cincinnati and Hamilton County and Toledo and Lucas County are where the 4 casinos are. So we would expect to see more calls in those counties. And then you get into the subsequent counties. Montgomery County is where Dayton is. Akron is in Summit County, Youngstown and Mahoning. So then you're seeing the contiguous counties next to the casino counties. And many of these counties also have the racinos, which are the horse racing tracks with video lottery terminals. So a lot of venue specific counties, if you will, are where we're seeing heavy call volume. But we do see it in more rural counties as well. We also know that through the most recent Ohio Problem Gambling Survey in 2016 and 17 that some of Ohio's largest problem gambling rates are in the rural counties, the counties that don't have racetracks and don't have casinos. So, it's really focusing on all types of gambling, lottery play, sports gambling. Many folks in the southeast part of Ohio are able to go to West Virginia and Pennsylvania for other forms of gambling that are not legalized in Ohio. So we do need to be able to capture those numbers and make sure we have resources available and readily available for all those folks, which is what we'll get into when we get more into the warm transfer project later in this webinar. You'll see at the bottom the reasons for the call and ages of the call. So ages are pretty spread across the board. And we do get calls from not only maybe the problem gambler themselves, but oftentimes a lot of the callers are spouses, parents, children, relatives. So people are calling for resources for others. And you can see what some of those reasons for the calls are, mainly financial problems, but all the way down to family problems, mental health, legal issues, substance use. So a wide variety of calls as well. We can move to the next slide, Derek. Thank you. This is the call frequency, so you can see it spread out throughout the months of the fiscal year, but also times of day. You'll see in March, Problem Gambling Awareness Month. Also, March Madness is one of the reasons that is Problem Gambling Awareness Month, where not only problem gambling rates spike, but also just social gambling. So for folks, many folks may be abstinent for gambling throughout the year, and it's not maybe for any specific reason other than they just don't gamble. But things like March Madness are so socially normalized that many people pick up gambling in that respect. So we do see higher rates of problem gambling throughout the month of March, which does then correlate to many more calls during the month of March as well. You'll see the calls that do come in over the night, many less than during the day, but those calls may be more crucial, more critical. Folks may be in some type of crisis. So this is really where we're going with the warm transfer project, being able to get calls that occur on nights or on weekends, get those callers the resources and link to clinicians as soon as possible, if not immediately. So we will be looking into that a little bit later. We can go to the next slide, and Derek's going to give you a brief intro into this project. So we just wanted to give you a little background on where we were coming from with the numbers across the state.
Thanks, Mike. And the Warm Transfer Project really came out of the great collaborations that we have statewide. So nationally, we're often referred to as the Ohio model, with really as the way to do things properly. So the development sponsors of this project include Ohio for Responsible Gambling, which makes up the Casino Control Commission, the Ohio Lottery Commission, and the Ohio Department of Mental Health and Addiction Services. So we have ORG as well as PGAB, the Problem Gambling Advisory Board. And that's made up of really people at all levels, prevention, treatment, those in recovery, coming together to identify what are some challenges that we see related to our gambling service system in Ohio, and how can we work to improve that. So with that combination, it really led us to the Warm Transfer Project. And this is one where the Problem Gambling Advisory Board had met for several months. There were dollars that were available. So the discussion really came into how can we maximize the resources that we have available and fill a service gap that we see within the state. And through those two things, it was determined that the Warm Transfer Project would be the best way to do that. And there was a RFP process that was sent out through Department of Mental Health and Addiction Services. PGNO applied for it, and we were awarded the contract for state fiscal year 20 as well as state fiscal year 21. Really, the purpose of the project is to, as it says on the screen, create and implement a warm transfer process resulting from calls to the Ohio Problem Gambling Helpline that operate 24/7, 365. So we want to make sure that if someone needs triage support services for their gambling problem, they can receive those services any time of day, any time of night, all year. And in speaking with individuals who have called the helpline, doing the quality assurance calls themselves, and me for trying to get resources for individuals who call me, we know that that system's not always in place. A month or so ago, I spent over an hour and 15 minutes on the phone trying to find a counselor in in the area that a lady was calling from. And I am pretty well versed in the system, know how best to make those calls, and still, after an hour and 15 minutes, had no referral source available to this lady who has a problem. Either I was told that the service provider didn't provide gambling services, or that the service provider that did provide gambling services, their trained clinicians had a full caseload and couldn't add additional clients. So certainly there's a service gap in the state that needs to be addressed, and we're hopeful that this will be a piece to doing that, along with some of the other pieces that we're working on outside of this project, but at PGNO, to really build out our service system. We want to create and implement that warm transfer process for those on-call clinicians during those non-business hours. So really there's two parts to it. One is making sure that during the regular business hours that we have support services in place, but also for all those that are calling outside of those business hours, that there's still somebody to call and connect with. It can be really hard to pick up the phone and make that initial call to the Ohio Problem Gambling Helpline. Then after you make that call, you're told, okay, well, this is a list of other calls that you can make in order to get the help that you need. And like the situation that I mentioned, hour and 15 minutes on the phone, I still didn't get the answers to those support services. And that's something that we really need to work on. I also want to make sure that we expedite those callers to the resources to those validated clinical services. So one other thing that we work on through the quality assurance calls, and that will be a component of this project, and Mike will get into additional details about the components, is to make sure that we have validated clinical services. We know that job transitions happen all the time, and it can be really hard to kind of nail down who provides gambling support services at what level, and making sure that they're qualified to do that. Not everybody can treat, and not everybody should treat gamblers. So those pieces really need to come into place, and that will be a component of the project. As for the process, Mike, do you want to kind of talk about how the process will work through?
Absolutely. So when needed, a Ohio Problem Gambling Helpline specialist that takes the helpline calls will make a warm transfer to Ohio licensed clinicians who will be contracted through PGNO as on-call and who are gambling disorder treatment qualified. Those clinicians will also, we would like them to be knowledgeable of Ohio's statewide service system. Derek mentioned what's known as the Ohio model and our collaborative approach, and many of the workforce resources that we develop and put on throughout the year, but also the numerous treatment providers throughout the state that are outpatient, that Ohio does have the Cleveland VA, which is inpatient, the really great Gamblers Anonymous groups that go on throughout the state, and Gamma Non is active in Ohio as well. So our statewide service system is large, it's robust. So being knowledgeable of that and all the different resources that are available is going to be really important when discussing resources with those callers. We also want the counselors to have in-depth knowledge of their specific region of the state. Again, we have providers throughout the state, inpatient, outpatient. Some providers have groups, some are only individual therapy. So really knowing what is available in your region and what the needs of the caller are, so we can match those together, will be really important. The counselors will be able to use the list of clinicians and service agencies for referrals at www.gamblinghelpohio.org. So they'll be able to look up and really pinpoint where this individual is coming from and what resources are most close to their site. And later, the clinicians will make follow-up calls to track the individuals who did follow through with making an appointment for services to see how that system went and how it is going. If we look at the next slide, will kind of take us through a stepped process of how we envision this going. So the call will come into the Ohio Problem Gambling Helpline. The specialists who answer the calls will work through their standard process of gathering the caller's information, such as age, location, gambling type, a lethality assessment. This is a really important piece. Derek mentioned earlier about co-occurring conditions with substance use and mental health. Problem gambling and gambling disorder does have the highest suicide attempt rate of any addiction at 20%. So it's crucial to assess lethality whenever meeting with a gambler. So that's not just our specialists who answer the calls, which could be in times of crisis, but also anytime someone is receiving therapy. So our counselors throughout the state do assess lethality every time they sit down with a gambling client. We found this to be a potential barrier for a number of reasons. If someone is not trained in how to have conversations around suicide, there can be some discomfort. There could be a lack of skill set of knowing what to say and when to say. So we noticed that through our quality assurance calls, which we will get to in a little bit as another component of warm transfer. But we noticed that through our quality assurance calls that only 11% of calls to the Ohio Problem Gambling Helpline were being assessed for lethality. 11% of 5,000 is 550. What we did is we made a training of lethality and QPR, which is question, persuade, refer, which is a suicide prevention evidence-based program. We gave that to the helpline specialists to increase their skill, to increase their comfort in having conversations around suicide. And after that training, the calls that were assessed for lethality jumped to 84%. So 11% to 84%. Breaking that down into numbers is about 550 calls to 4,200 calls. So that is a huge difference. And when we're looking at those calls that could be coming in on nights, could be coming in on weekends, people could be in crisis, having a effective lethality assessment and having it with a counselor who has treated gamblers can really have an impact on the individuals that are calling, and hopefully diminish the harms associated with that lethality correlation to gambling disorder. So we think that's a really important piece. After the specialist goes through their standard process, they'll ask the caller if they would like to be connected to a gambling counselor. If the caller says yes, the specialist will obtain the caller's phone number in case of a disconnect, and they will also obtain verbal consent to share their information with the counselor that they'll be connecting with. They'll be placed on a brief hold, and the specialist will contact a counselor and proceed to step 5. If the caller says, no, I would not like to speak to, or I would not like to be connected to a counselor, yes, Derek, you can move to slide 4, thank you. Then the specialist will ask, okay, would you like to have a gambling counselor call you? And if the caller says yes, then the specialist will ask the caller for their best phone number for the caller to be reached at, and also if it would be okay for the gambling counselor to leave a message. The specialist will then ask if there are any additional needs of the caller, and will conclude the call. Then in the future, hopefully very soon, a counselor will be connecting to them, which would be step 5. If the caller said, no, I do not want to be connected to a counselor right now, and no, I would not like to have a counselor call me back, then the specialist obtains an email address to send follow-up information and resources to the individual, asks if there's any further additional needs or information, the caller, and they would conclude the call. Going to the next slide, step 5. This is where we are if the caller specified that yes, they want to be connected with a counselor. If it is during normal business hours, the specialist will contact an agency directly and see if a counselor is immediately available, and if they are, they'll be connected. If the counselor is not immediately available, the specialist would proceed to step 6, which, if we look to the bottom of the slide, the specialist would then inform the caller that a counselor is not currently available. However, one will contact them within 60 minutes. Specialist will confirm the caller's best phone number, and again confirm that they have consent to share information with the counselor, and the counselor will call them back within the hour. Moving back up in step 5, sorry, Derek, thank you. Step 5B, if that call is being made in non-business hours, this is where our on-call counselors will come into place. The specialist will first contact the extension of an on-call counselor associated with the region the caller resides in. If there's no answer, the specialist will try an extension associated with subsequent regions. So we really want to have counselors on call spread throughout the state. If someone calls from the Cleveland area, we'd really like to connect them in a perfect world with an on-call counselor who resides in Cleveland and works in Cleveland. Again, going back to the slides, previous slides about really being knowledgeable of the services that are available in your region of the state, we think that's a really important piece. However, if someone is not available, then we would go to subsequent regions. So maybe someone down near the Canton or Youngstown area is available, and then maybe we'd have to go down to Columbus. And we think our on-call counselors are going to have a really good, a good idea and be knowledgeable of the entire statewide service system. But for obvious reasons, we'll try locally first. Okay, next slide, please. Thank you. This is where we are if someone is calling an on-call counselor. Upon reaching the counselor, the specialist will provide the caller's name, phone number, brief background, and resources that have already been provided. Also, if it's okay to leave a message. The counselor will then contact the caller. Counselor will provide triage support to the caller and will assist in making connections to resources that best fit the caller's needs. So again, our counselors will have in-depth knowledge of not only their region, but statewide services, and we'll also have gamblinghelpohio.org open to see what services are most closely related to the individual's location. We think the triage support will also be necessary, again, when we're looking at things like the lethality and that some of these calls may be in a crisis situation. The last step, the counselor will make follow-up calls to the caller to ensure that services that they requested are being received and if any further additional support is needed. Moving forward, our operational plan to get all of this underway. We have current applications open for our on-call counselors. We do have a day-long retreat scheduled for on-call counselor onboarding on Friday, May 22nd. This has an asterisk for where we are now in our world with COVID-19 and the suspension of large gatherings. This will be again reassessed in a few weeks, but as of now, we are scheduled for Friday, May 22nd at the Ohio Department of Natural Resources in Columbus, Ohio. At this day-long retreat, we'll provide further information and a little bit more in-depth information around the warm transfer project. We will discuss phone operation, the standard operating procedures for using the phones for the warm transfer project. We'll discuss the triage training and what is entailed with that. Attendees will also hear from Ohio Problem Gambling Helpline specialists that currently run the helpline, the project team, and also recovery advocates. We will also hold monthly meetings for the first part of the project until maybe we're able to move to bi-monthly. But at the beginning, we'll hold monthly meetings with our collaborative partners, Ohio for Responsible Gambling, Problem Gambling Network of Ohio, and the Problem Gambling Advisory Board. The on-call counselors will be in these monthly meetings, some of the helpline specialists and helpline representatives. In these meetings, we'll establish the framework and really functionality of the process for contacting provider agencies during normal business hours and on-call counselors during off hours. During these meetings, we'll also create, edit, update as needed the phone scripts and step process for the helpline. This is something that's new. We don't know of many other states that are doing this. So it will be a learning process. So we will be updating, if need be, updating the phone scripts, updating the process to best suit the needs of the caller, to best expedite resources to them. We'll be identifying the standard triage process for counselors, create an outreach plan for providers to better understand the goals of this process and project, and ensure appropriate flow when specialists make warm transfers during normal business hours. So again, Ohio has over 80 providers. These are nonprofit agencies. These are private practice individuals. Many have different services. Again, if it's individual therapy, family therapy, group therapy. So really making sure that these agencies are aware of what it is that they provide. As Derek said, there's turnover. So we want to make sure that everyone, we're providing the correct information to callers. Establish engagement plans for area ADAM boards. We'll want them heavily involved and bought in. And then also just ongoing quality assurance. So we do the quality assurance for the Problem Gambling Helpline. So not only continuing quality assurance for the helpline as a whole, but really the assuring quality for the specific warm transfer as well. Applicants, who it is that we're looking for to help us out with this project. We're looking for approximately 10, but we don't have a number necessarily written in stone for on-call counselors. We'd like them reasonably dispersed throughout the regions of the state, again, leaning towards the expertise and knowledge of those regions. We want them to provide triage services to those who request to speak with a gambling counselor after being prompted by a helpline specialists. Calls to the helpline outside of normal business hours can be crucial, and providing services to these callers is critical. On-call counselors will be trained and compensated competitively as contractors of PGNO. Eligible applicants must hold at least an LISW, MSW, LPCC, or LICDC. Holding or in the process of obtaining the GAM credential through the Ohio Chemical Dependency Professionals Board is also preferred. Next slide, please. Other program requirements. Completion of 2 quality assurance calls per month to the Ohio Problem Gambling Helpline. As we stated, PGNO does do quality assurance calls. We have seen vast improvements from doing these calls, so we'd like our counselors to also be aware of this process, what it is that we're looking for, what it is that makes a call successful. So when people are hanging up, they feel as if they've been treated appropriately, that they've been talked to without stigmatizing language, that they've been given the resources they need to make the next steps. This will be discussed at the retreat. We have a little evaluation form to do the quality assurance calls, and it's simply, if you're a clinician, you can kind of put a case in the back of your head and ask questions as if you are a client that you see. You could also call in as a spouse or as a friend and just say, you know, I have someone in my life that I think is a problem gambler. What is available? So you're really just kind of cold calling the helpline. And we do have some prompts and some evaluative tools that you can use to evaluate that call. We'd also have our counselors attend the in-person or phone monthly meetings. Again, that's going to be very important to see how the process is going. All selected on-call counselors will be expected to complete a criminal background check, and all selected on-call counselors will be expected to maintain liability coverage, which will be reimbursed by PGNO. As I said, the application is live currently on the PGNO website that you can follow the link there. Applications are due Monday, March 30th. It is not a long application, so please take a look. And as of right now, again, with an asterisk because of our current state of affairs, acceptance letters will be sent out Friday, April 10th. That may be pushed back, but as we have been doing, we will stay in touch with everyone. And you can always find updates on the PGNO website and in the newsroom.
And if you don't want to type in that super long web address, you can just go to the homepage at pgnohio.org, and one of our rotating slides will include the link to all of this information. So now we've reached our question and answer section for today, and we've not yet received any questions. So if you do have questions, please feel free to reach out to either Mike or myself. You can call us at 614-750-9899. I'm at extension 101, and Mike is at extension 102. You can also email us at first initial last name at pgnohio.org. For additional information and to stay up to date for all things PGNO, you can sign up for our newsletter at pgnohio.org. You can also follow us on Facebook and Twitter at PGNOhio. Thanks so much for joining us today, and look forward to listening to your questions and engaging with you further as our project continues. Have a wonderful day. Thank you.
Thank you.